All right, welcome everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa. I'm owner of PAR5 Physical Therapy here in Randolph, New Jersey, and I partnered with them to bring you this easy and educational workday session. Today's session is knee osteoarthritis, otherwise known as knee OA, and joint preservation techniques. A little bit about me. I've got my doctorate from Mercy University now in upstate New York, and an exercise physiology degree from Rutgers in New Jersey. So I'm also an orthopedic clinical specialist, specializing in orthopedics and golf fitness. So I'm also certified a level 3 golf medical professional from the Titleist Performance Institute. All right, so I want this class today to be as helpful and informative as possible. So feel free to use that chat window and let me know if there's anything specific that you're going through that you want to let me know about. So without further ado, let's kind of pull up my slides here. And we're talking about knee, OA, and joint preservation techniques. Okay, just because I'm a physical therapist, a medical professional, I have to give this disclaimer whenever I give a presentation. If you're dealing with something specific, please get a thorough physical exam from a medical professional. The stuff that we're going to be talking about today is very general and it is geared at a broad population. So to have your specific issues addressed, you have to get that thorough physical exam. All right. Now, as we're going through these things that we're going to be talking about, whether it be stretches, movements, techniques, whatever, don't push through pain. A lot of times people say when they come to see me, they're on my table or in the clinic, and they're saying, hey, no pain, no gain. I will say this, is that that's not true all the time. There is discomfort when we're trying to change tissue, but there should never be pain. If you're doing an exercise and it hurts, those movements, that exercises should be scalable or modifiable so that you can do them without pain. Pain is not a normal thing of getting old, all right? That's one thing that I hear a lot of my clients say, like, they're getting old, they're just gonna be like, it's age, I'm 60 or I'm 50, my joints are breaking down and that's the way it is. That's not the way it is. That doesn't have to be the way it is. We have 60-year-olds, 70-year-olds doing CrossFit, running marathons, not always having pain. Not every 60-year-old is built the same. Their fitness level, their wellness level, their health level is not always the same. And if you want to be able to enjoy your later years in life and be as independent as possible and be strong, durable, resilient, it's not too late to start with an exercise program to really focus on where your deficits are. Think about your exercise and workouts as being your fitness and health and wellness financial plan or retirement account, right? You put away money in your younger years so that you can withdraw from that IRA or account later on. Now, same thing goes for fitness, exercise, diet. Those things that you can do when you're younger and as you grow older, you can withdraw from them later on so that when you're 80, 90, 100, you're not going to be relegated to just a chair, a wheelchair, sitting around, enjoying, watching people have fun. You can participate in that fun, all right? So we want to be able to kind of integrate a lot of the things that we're going to be talking about to change behavior, movement, so that we can preserve our joints for as long as possible. Now, if you remember anything from any of my classes, remember this one thing. If you've been to any of my classes before, I always put this video up because it summarizes like 6 years of physical therapy education in one 10-second slide. The body functions on an alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So you're going to see this a lot later, that if we're looking at the knee, for example, right? Knee osteoarthritis. The knee is a very simple joint. It is designed to be stable. All it does is bend and straighten. That's all it is. It's very simple. I mean, there's a little bit of rotation in there, maybe like 5-10 degrees, but really it just goes straight and it bends, right? Now, the joints above and below that, the hip, the ankle, those are designed to be mobile. Oftentimes what I'll see is that people have very tight ankles. They lose their mobility in their ankle. So their body says, hey, I've lost mobility in one spot. Let me try and borrow it from another. So it makes the knee unstable. It makes the knee a mobile segment. And that's not the way it's supposed to be functioning. All right. So here's a close-up look at what osteoarthritis is, what wear and tear is, whatever, right? We have, doubtful, the number one over here, where everything's good. The cartilage is all white, it's soft, there's a lot of joint space. And then we have all the way over here where we have a lot of breakdown, right? Not a lot of space in between, and the cartilage is worn away. And you know what? That's normal. That happens with everyday life. You live on Earth, it has gravity, and your joints have a certain mileage to them. That's fine. But whether or not that this causes pain and dysfunction is another story, all right? Everybody over the age of 40 has arthritis. I said it, all right? If you're over 40, you have arthritis. You go get an x-ray, they're going to find arthritis. They're not going to find a clean bone, all right? You enjoy life, you're moving around, you're using your legs, you're using your knees, you're going to have something, all right? Now, what really matters is how you move. How do you use that leg, all right? So this is one principle that we look at. When the knee bends and straightens, there's an axis of the joint. So what this is a valgus force over here. When the knee, shin, and the femur, basically the lower leg and the upper leg, they don't match, they're not straight. And then over here, everything is straight, hip, knee, ankle, foot, right? So if you're stepping down from a chair or stepping down from the stairs, right, going downstairs or getting up out of a chair, anytime your foot's on the ground and you're bending your knee, if your knee bends like this, then that's the reason why that we have issues. And this happens because of either ankle mobility problems or hip weakness. Here's another picture. If you're squatting or going down to pick something up or sitting in a chair, if your knees are lined up over your feet, good, right? If they're like this, that's bad, all right? That's creating a lot of excess shearing on that joint, all right? Here's another thing, walking, anytime that you're in a single leg stance, you notice here the foot, the way that the foot is pointed, it's pointed outwards, right? So you can see how that pointed outward, this one's pointed forwards. Now, when people have a tight ankle, when they have limited ankle mobility, they usually start to walk, stand, squat with their foot turned out. That's basically your body's way of seeking another way or movement around or compensation around that tight ankle. It'll turn the foot out. You'll see like a rotation or plantar, a pronation of your foot. You lose the arch, the foot's pointing out. And then all of a sudden the relationship of that knee, hip, and thigh are all this way, right? One's going inward, and then it doesn't look like this, okay? So the next one here is what I mentioned earlier, that ankle. If that ankle is tight, then we get what we call ankle pronation, that flat foot position. And then the tibia rotates. We don't like rotation of the tibia. That's that lower leg bone. And then the knees get knocked in, and then the hips kind of go in. So this is a chain of events that happens from the ground up when there's a foot problem, all right? So I had a client the other day come in and tell me that they had some knee pain, and they went to their physician. They said their physician said, don't squat anymore. Stop squatting. You're exercising, you're just wearing out your knees with squatting. That is completely baloney, all right? I'm going to say this right now. If your physician says don't squat anymore, tell them that they're wrong, because every time that you go up and down stairs, every time that you sit down and get up out of a chair, off the toilet, out of your car, you're doing a squat. So if you don't exercise and move through those normal physiological ranges of motion, the way that your body was meant to move, and you avoid it, then you're just going to get weaker in those motions. So every time that you get up off the couch, get up off the toilet, oh, the knees are going to be stiff. So that's it. You have to squat to maintain good, healthy knees. All right. So we're going to talk about lunges. What are they? How to squat, how to move, and stuff like that. All right. So let me pull up my two-shot here, and let's talk about how things are supposed to work. All right. So I showed you in the picture how when we get up and down off a chair, just really simple, all right? Our knee likes to bend and straighten. Hopefully I'm in line with the camera here. All it does is just this. It doesn't like to rotate. There is, if you're going to ask anybody if there's any medical professional in the class right now, there is a 5 to 10 degree rotation of the knee when you lock it out. And that's normal, all right? It's called the screw home mechanism. Don't worry about it. What we're worried about is what happens when you get out of that position, right? So getting up out of a chair or standing up, we want to make sure that we plant our feet and they're not turned out, right? So that video, that picture of the feet turned out no good, because once your feet start to go out, your knees have to go in the same direction. They have to go here, okay? If my foot's pointing out, I have to go there, right? And this turned out position of my legs creates a much more difficult position to create torque and power, right? To move our body, our muscles have to be strong to create force. When you're here, it's harder to create force because the foot is in a bad position, all right? So what I would like to try, have you all try at home, is to make sure that your feet are hip width apart and make sure that they're totally straight, all right? Number one, you might think that this is totally straight, but it's not. You might feel when you turn them straight that it's turned in too much. That's just your body's way of saying, hey, this is an abnormal position because you're so comfortable being like this, right? So we want to make sure that we can, over time, change that and make this your new reality, that this is a way, at least straight. Maybe I'll allow for 10 to 15 degrees of turnout, but we'd like to be straight, because when your feet are straight, you're able to create a much more stable surface through the foot and the ankle to create force. Now, when I go to stand up, the big thing is that I want to use my hips, right? Using the hips is a much deeper, more durable joint than the knee. So people say, oh, I need to strengthen my quad or whatever. Meanwhile, they really neglect or they forget about how important this glute muscle is here. It's the muscle that you sit on, all right? It's your butt muscle. And what that muscle does is that it straightens out the hip, but it also does this, all right? It pushes the knee out or externally rotates the leg, right? So if my foot is planted, it doesn't move, and I activate that glute muscle, it does that. It turns the knee out. It prevents the knee from going in like this. So if I stand up, I want to be able to access that muscle, access that torque, that power. Keep your feet straight, push your knees apart, and really lean forward here. The more that my nose and my shoulders are over my toes, the more I can push through a flat foot, not just the ball of my foot, and create tension through that glute. So as I stand up, I don't lose that position where the knees go in. We don't want those knees to buckle in. And the same thing for going down. As you go to sit, the key with this to protect the knee is to minimize this, knock-kneed position. All right, so knock-kneed position. People will think, all right, I have back issues or whatever, so I got to keep my back straight so that when I sit down, I have to sit down like this, really straight. And all of a sudden, the knees, the quads are very weak in terms of holding your body up. They're not strong as your hips. And then all of a sudden this happens and you go to sit, oh, I plop down, right? Now, another thing I want to talk about, that was from the forward direction. Now, if we talk about how things are supposed to move from the side view, people usually say, if the knee goes over the toe, that's a no-no, right? So the knee goes over the toe. Like, let me show you on this. If I take my foot, keep my foot flat, and bring my knee way over my toe, that's not good. That creates a lot of pressure on my knee. Actually, this research shows that the compressive force of the kneecap on the joint underneath actually reduces past 90 degrees. When you get down this low, there's less stress on the knee once you get that past this position. If you're just squatting like this angle probably creates the most amount of stress. So mini squats are no good, all right? Now, it's inherently not bad to bring your knee over your foot. I mean, your knee over your foot, right? Over your toe line. But the problem with this is that most people lack what we call ankle dorsiflexion. That's basically this movement here because of tightness of the ankle. If you can't have that angle because of the tightness, then when you put your foot on the ground, you run out of room and that knee can't go forward. So with a tight ankle, what happens is that your knee can't go any more forward than this. And then all of a sudden people will start to lift their heel up because they're limited with their ankle, their knee can't go forward. And that creates a lot more stress on the knee. And then therefore you say, hey, you know what? Don't let your knee go forward, all right? So the first thing that we wanna do is make sure to protect the knee joint, we wanna make sure that your ankle is as flexible as possible, all right? So what I like to grab is my little foam roller. It's a half foam roll, okay? You don't have to get something fancy like this. You can get like a rolled up towel, a textbook, it doesn't matter. But ankle mobility is important. So men, women, I mean, how many times I've seen this? It's like so tight because people don't get into this position. You elevate the front part of your foot, the heel stays locked on the ground, your knee is straight, and then you bring your hip forward. From this position here, you should feel a stretch. All right, fair enough. 30 seconds is the bare minimum amount of time that you want to hold. You got to make sure that the heel stays locked down. Now, another version of this is bending the knee and making that knee bend over the toe like this, keeping that heel locked, all right? So this is where we start to retrain our brain, our joints, our body to move a certain way if we just break it down into a simple move like this. So this is how it looks from the side. My heel stays down, my knee's going forward. I'm trying to get it over my toe, right? Some people who have tight ankles can't go that far. Now, the key thing is, what does it look like from the front? All right. So again, like we said with the other sit to stand maneuver, if I'm planting myself here, my foot's totally straight, and I bring my knee forward, does this look good? No, it's not. My knee is and my thigh are not matching where my foot is. Again, you'll probably feel a lot looser in your ankle if you let that foot go out and then do this. So now my knee and my foot are not matching in their line. And then we kind of perseverate this whole movement dysfunction that brings about knee pain. Want to make sure that that foot is totally straight, heel stays locked on the ground. And then when I bring that knee forward, everything is in line. You do this in front of the mirror, you could see. Or if you look down, you're looking at the line of your thigh from your hip to your knee, that should match in the same direction as where my foot, where your foot is pointing. All right, so if I go in and out in that position, again, trying to retrain the brain, retrain your joints, retrain your body to move in this way repeatedly over time. And I'm going to say, you know, studies show that if to make something your new motor pattern, you have to do 1,000 reps. So that's why I said, you know, just fit this in throughout the day. Do it when you're on a conference call, watching TV, doesn't matter. Just move correctly. Make every rep good. Don't just blindly do it and be like, oh, you know, checking my phone or whatever and doing this, because again, you will reinforce your poor movement pattern and then your knee is going to hurt. All right. So that's that ankle mobility stuff. Now, that's the key thing. And again, if we're doing stairs or steps, and it's the same thing as, same principle as getting up out of the chair, it's just with one leg. This is a high step, it's 12 inches. But if I step onto this, I don't want my knee to go on like this. I don't want to have my foot turned out and then doing this. So ankle mobility dictates where your foot can go comfortably, has to be straighter than what you normally would think. And the hip joint, that external rotation, that strength in the glute, can control your knee and prevent it from going in, so that when you step up, it doesn't go in, or when you go down, it doesn't go in either, especially going downstairs. Every time you go downstairs and it just kind of goes in like this, then you're going to run into problems. Now, let's problem solve. If you're super tight in your ankle and you can't get this and you're doing all the stretches, the worst thing that most people complain about when they see me is going downstairs is the worst. It hurts the worst, right? So let's think about some strategies to preserve your joint when you're going downstairs. So let's just say my left knee is the one that hurts the most. It hurts, it doesn't feel good. You know, I'm gonna work on that. And I wanna go down the stairs, okay? If I'm gonna go down the stairs, let me see if I could point this straight here so you can kind of see. All right, cool. This is a big step, so it's going to be very challenging. So one technique that you can do to make up or release this ankle joint, if you have a tight ankle which forces your foot and you need to do this, if you step down off of a curb or a high step or whatever, start with your foot off the step like this. right? So I'm using my midfoot as a hinge right off that edge. So that way I don't have to be compromised or limited by my tight ankle. So that when I go down, as I go down, my knee can go in the direction that it needs to go in front of my foot because I just rolled over that midfoot. Okay, so going downstairs, that's one way. Another technique is to go sideways and always lead with the stronger leg, keep the weaker leg up top. So if I'm gonna go down sideways, I'm gonna go down and lower myself like this, trying to push this knee out at the same time as I'm going down. I mean, you could go down with the stronger leg, but then, you know, you've got like this thing landing a lot. So you can go either way. Sideways is better. Either foot, either leg, whichever you feel stronger with, and you always have a railing there. But the big thing, if you are going sideways, here's a front view. All right, if I'm going to lower myself sideways off of a step, the knee cannot go in like that, right? So I can't do that. I have to really access that glute muscle and then push that knee out as I go down into that position. All right. And then a lot of times people will say, you know what, how do I strengthen my glute? I'm doing squats and other things. So when you're squatting is very similar to just getting up and down from a chair, right? So we can kind of do the same thing and make this your exercise here, straightening the hip, bending through the hip, keeping the nose over the toes, and keeping everything in line as what we talked about before, right? So that turns into an exercise. The other thing that we can do is a movement called a hip hike. So again, you can do this on anything. I just have this because it's convenient. But I'm standing on one leg. Let me use a little pole here so that I'm able to balance on this thing. So I just have the one leg here. My right leg is free. This exercise is for my left hip, my left gluteus medius muscle, right? My left butt cheek. What I'm going to do is keep my knees straight. I'm not going to bend my knee. And I'm just going to take this hip, this pelvis, and then bring it up to the ribs. That's it. It's a very small motion. It's not a lot of motion. It's just bringing this up. My knees do not bend. A lot of times people will do this. They'll bend the knee because they want to compensate. Body moves through these paths of least resistance. So if it notices a movement is weak or difficult to do, it'll just find a different way to do it. So you have to be very specific with this technique. Lock out those knees. Do not move the knees. And we're just going to hike that up, maybe hold it for 2, 3 seconds, and then lower slow. Hike it up. The higher it goes, the more you'll feel it on that hip, right? So that glute muscle will help control that knee when you're weight bearing on the ground. And, you know, there's a host of other exercises that we can go into to activate or strengthen that glute medius. Probably a little too much for our class today. All right. So that's a little preview. Let me pull up my my first camera here. So that's our class today on knee OA and some joint preservation techniques. Now's the time. If you have any questions, use that chat and let me know if there's anything that you want me to cover or talk about or have any questions about. Otherwise, I'll give you a 30-second countdown and we're going to close it out so you can enjoy your sunny Tuesday. All righty. Okay. All right. Doesn't look like anybody's putting their hand up or chatting in the box. Oh, there we go. A whole bunch. All right. There we go. Let's see. Are the same exercises valid for knee replacements? Yes. You've got a knee replacement. It's got a limited lifespan. All right. That's why they don't give 25-year-olds a knee replacement when they have knee problems, because it only lasts for about 20 years. So preserve your knee as much as possible. It's the same principles. The knee, if it's a fake knee or a replacement knee, you got the same principles. You got to make it move the right way. That thing is not durable, bulletproof, or anything like that. It's made. Its surfaces are plastic. All right. Let's see here. And let's see. Oh, recording is going to be out. Yeah, we can put all that out too. So there's going to be this class and many more on demand in any of the Better Spaces apps. You can look for them. All right. Cool. All right. Well, thank you for joining me today. You know what? I'll be back next week. Is it next week? December? No, December 5th. I guess December 5th. Well, I don't know when that's going to be, but we're going to talk about lifting ergonomics, how to protect your back. You're going to learn 3 key moves to protect your back when lifting or bending over. And number 1 may surprise you. I don't know, I'll give you a little bit of insight for that today. Hey, if you have any questions, you can email me here at paul@par5pt.com or team@betterspaces.com. Hey, thanks for coming and be well. Bye-bye.